If you are sexually active, condoms will be very effective at preventing STDs when used correctly. Next, reduce the number of partners you have. Also, get yourself vaccinated. Certain STDs can be prevented, like hepatitis B and HPV. And lastly, get yourself tested regularly. I will ask a few questions regarding the patient's exposure, patient's concerns. Then I will advise patient also STD screening as required. STD screening mainly it can be done through blood and also through urine. And for females, it might also entail swabs in the genital areas. At our clinic, if a patient is tested positive for STD, I will sit down with them, explain the diagnosis and offer them what kind of treatment is available. Usually it's antibiotics, and sometimes they might require more complex treatments. DSC Clinic did a survey and study the top 5 STDs in Singapore are chlamydia, gonorrhea, syphilis, genital warts and genital herpes. Chlamydia is a bacterial infection and it causes pain when the patient pees, discharge and discomfort. Gonorrhea is very similar to chlamydia as well. It also causes pain when the patient pees, discharge and discomfort in the genital area. Syphilis can present as ulcers in the genital area, and it can progress to rashes and also in a very chronic severe case infection of the brain. Genital warts are caused by the human papilloma virus. It presents with growths and lumps and bumps in the genital area, and it can spread quite extensively. Genital herpes is a viral infection and it causes blisters and ulcers in the genital area, which can be quite painful. If a patient gets it, it can't be cured, it can only be managed. Depends on what sort of STDs. For example, if it's chlamydia and gonorrhea, they can be given antibiotics. And for genital warts, they might need more complex treatment like freezing liquid nitrogen or application of medication on the warts. For genital herpes, there are antiviral medication which they can take, and there are also creams which they can apply on the blisters. STD is a broader umbrella where HIV falls under it. So HIV is a type of STD, and the other STDs are chlamydia, gonorrhea, syphilis example. Generally speaking, if a patient is sexually active, a good time frame will be every 12 months. But if the patient has multiple partners and the sexual activity is more high risk, like unprotected sex, then it should be more often.